Good afternoon, everyone. Welcome to our town hall today. My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs at Hamilton Health Sciences, and welcome to today, March 18th, virtual town hall for Hamilton Health Sciences. We have a packed agenda and we'll get right to it. We'll have a chance for questions and celebrations at the end. But first, I'm going to invite our President and CEO, Rob McIsaac, to kick things off. Rob, over to you.
Thanks very much, Aaron, and so welcome everybody, as always, to this week's town hall. We have another full agenda that includes an overview of operations across our sites. We are seeing a fair bit of stress this week. A look at what is happening with the virus globally, here in Canada and more locally. An update about the vaccine rollout for healthcare workers in the city, a question and answer segment as always, and of course we'll be encouraging celebrations for the organization. In follow-up to last week, I'd like to note that we continue to remember and acknowledge the events, losses, and changes that the pandemic has left in its wake. In addition to the reflections on the National Day of Observance on March 11th, we've been sharing articles and resources through the Daily Dispatch and via social media. You might have read the personal essay by Dr. Andrea Frolick, HHS's Director of the Program for Ethics and Care Ecologies. It was originally published in the Globe and Mail and subsequently in our HHS Share newsletter. It's the first chapter in a 4-part series of stories about the past year. So I just encourage you to check the Daily Dispatch, our social media channels, and HHS Share for more about our ongoing activities concerning reflection of the events of the past year and the impacts that it's had. This past year has demanded a lot from each of us, but there are some important signs of hope that I think we can grab onto. While there have been bumps in the vaccine rollout, we are making progress. In our city and across the region and province, we are scaling up vaccine clinics and seeing some increased confidence in the supply and distribution chain. I know that it has been frustrating for many that the focus has become providing as many people as possible with a first dose of the vaccine. But I also understand the provincial strategy, which is an attempt to maximize the utility of a highly constrained resource. The province is making the best of a very difficult situation. Whether or not you agree with that, I think it is what it is. We will abide by the direction we are receiving from the province. I can assure you we will share as much information as possible every step of the way whenever there is a change or update from the province in our processes. And finally, just before I hand it back to Aaron, a note of thanks to all of those who have been planning for the setup of a temporary structure across from our Hamilton General Hospital, and to all those that have had to change their parking arrangements. I would say it is still not a certainty that we will proceed with this structure, but if we do need to do it, we will have done all of the necessary groundwork, and that will facilitate an expeditious construction or erection of that facility. Once again, thanks everybody for your ongoing compassion and dedication to our patients and for supporting each other. Having said that, I will pass it back over to Aaron for another of our weekly polls. Thanks all for attending today.
Okay, thanks, Rob. We're going to run a quick poll as we have been doing in the past. The questions are a little bit different today. When you see it launched, there's 3 questions today. We've been noting some very equivalent balanced participation across our different sites and roles at HHS. Today, we want to get a sense of within that audience that we see attending, do you join on a weekly basis? Do we have a lot of repeat participation? If you don't attend, do you watch the recorded version? I know we've been sharing that every day on the dispatch, and we see quite a high viewership on it. We'd like to know if among those here today, is that something that you do as a backup strategy by default? And then lastly, do you share any of the information? Is it a helpful way for you to have discussion points with your colleagues? Or is it something that you actually might send the link to someone and encourage them to view when you see a topic of interest? So for those on today, we're reaching a pretty good participation. We'll just let it go to the end of a minute. We really, really appreciate you taking the time to fill out the survey. It helps to inform our strategies for maximizing the utility of this particular forum. So thank you very much for doing that. And that'll continue to help us a great deal. So next, I'd like to invite Sharon Pearson, who is our Executive Vice President of Clinical Operations and Chief Operating Officer, to give an update on what's happening across all of our services and facilities. So Sharon, over to you.
Thanks, Aaron, and good afternoon, everyone. And once again, want to update everyone on the various sites that we have and how we're doing since last week. As Rob indicated in his opening remarks, it's very stressed across all of our sites right now. We have seen that rise in COVID patients, much closer to what we had seen earlier in wave 2, where we peaked around 100 COVID patients. Now we're sitting around 90 across our sites, with the majority of those patients distributed between the Juravinski and the general site. We have also seen that concurrent rise in our outbreaks, with 5 outbreaks currently, 2 at the Juravinski site and 3 at the Hamilton General site. So I know they are placing inordinate pressure on the teams and on our flow and access. So consequently, we see those very high occupancy rates with 108 and 107%, which is pretty staggering at the General and the Juravinski site, respectively, 122% at West Lincoln. So important to note, all of our sites are feeling these pressures. McMaster, St. Peter's are very close behind and very close to 100%. Unfortunately, we have had to cancel some of our elective activities as a result of these pressures. We are working with our regional partners. They have reached out. We have reached out to them to see what we can do to try to alleviate the burden that we have right now with respect to the flow and the activity through our ED department. All of the existing or pre-existing work related to census balancing across the region and province, that still remains in place. So our H&HB, Lynn, and region continue to receive patients from out of region, and you can see about the 60 some patients below and what has come specifically to the Hamilton General to date. So that activity continues, and there continues to be heightened focus on our critical care resources right now as we see those numbers being significantly high across the province. So we'll continue to manage and look at our contingency plans around further expansion. And if you could go to the next slide. Rob already indicated our work on the temporary structure does continue, as does the prep work and the parking space there. I was asked if I could convey a message that if there is available parking in the patient spaces, that we don't use those spaces. We still require those for our family and patients visitors. We will share when we can any of the details related to the temporary structure as well. And again, echo Rob's thanks, and we apologize for the inconvenience with the parking and the access through that footprint. The last comment I wanted to make is there's been a fair bit of conversation both internally at our sites, but also at our community tables and with our primary partners around patients who are missing some of their diagnostic and clinical follow-up appointments. So I would ask when patients are discharged, if we could reinforce and remind patients and families to make sure they attend their follow-up visits, be they diagnostics, be they within our own specialty clinic facilities or with the specialists in their offices or primary care. There is a significant percent that are missing that follow-up. And what happens is there's delayed care, and then the sequelae from that, and some more advanced acuity that we see arriving in our ED departments as well. So if you could do that, that would be greatly appreciated. Thanks to everyone. I know it is an incredibly difficult time at the sites right now, managing in this stressful environment. So thanks for everyone for doing what we always do for our patients. And back to Aaron.
Thanks very much, Sharon. Next up on our agenda, as always, is an update from Dr. Dominic Mertz, our Medical Director of Infection Prevention and Control, on the epidemiology across the country. Welcome, Dominic. It's looking like you've gotten a haircut since the last town hall, so that's nice to see. Congratulations, and looking forward to what you have to say today.
Yeah, one of my achievements between the lockdowns was to finally get a haircut. Thanks, Aaron. Yeah, when you're looking at the map of Canada, if you remember the numbers from last week, Canada was sitting at, I believe, 55 or 56. So from a national perspective, a small increase in terms of cases per 100,000 per week. When you're looking at the colors here for our RT, you see that what's happening currently in Hamilton is not unique to Hamilton, obviously. So most provinces other than Quebec are or tend to go upwards with their case numbers at this point. Saskatchewan remains the one with the highest numbers. RT just above 1 right now with 1.2. The highest RTs are currently in Manitoba and in Alberta with higher than 1.1, but keep in mind those can change within a few days. Ontario at 1.01 as per yesterday. Next slide. And that's the Ontario data. I added a black line, which is sort of where I expect us ending up by the end of this week. So probably slightly higher than last week in the range of 60. So a continuing slow increase in case numbers. On the next slide, you will see your hospital admissions. At the provincial level, slowly increasing, but not significantly yet when you compare that to the increase that we've seen when we were running into the second wave, but certainly more than it's been a couple of weeks ago. Next slide. The Hamilton view, we certainly see more of an increase locally in Hamilton than Ontario sees on average. This week, I expect us to land somewhere in the range of 80, so similar to where we've been last week. So the good news here is it doesn't look much worse than last week, but it certainly still looks worse than the weeks prior to that. Next slide. This is the community cases, so taking off the outbreak cases, close contacts, travel, etc. We hit that benchmark of, or that threshold that we put for our policies at 20. Unfortunately, the line here is wrong. That should be on where 20 is. But nevertheless, you saw an ongoing increase the last couple of days, looking a little better. But remember, those may still move upwards once all the cases are attributed to either a certain exposure or remain unclear and as such considered a community case. So again, some stabilization over the last week, I would say, but definitely not going down here either. Next slide. And that's what Sharon already alluded to. We see a significant increase in admitted COVID-19 patients. Now, I think it's important to point out here, roughly half of what we have admitted, they were already here, but roughly half of the new COVID patients in hospitals are related to the many outbreaks we currently see across HHS. So it's less the pressure from the community at this point of time. It's sort of the pressure that we unfortunately generate ourselves due to the outbreaks. And just one reminder here, I know We are all tired. There's PPE fatigue, hand hygiene fatigue, etc., etc. The last few weeks had been more forgiving for those minor breaches. The way the pandemic is heading now, it will be more important again to do the very best you can in terms of adherence to all those infection prevention and control measures. The vaccines do help, and by no means get your vaccine whenever you can, but we still need those other measures in place as well to prevent outbreaks, and if it occurs, to control those outbreaks very quickly. And I think the other piece we've been struggling with in terms of outbreak management is people refusing to get tested. So staff testing is very important for us to understand the extent of outbreaks, to be able to stop those outbreaks. So please come forward and get tested when employee health asks you to do so. And this will bring those numbers back down again and will reduce some of the pressures we have on the hospital. Next slide. Where are we at? I still use this PHAC modeling just to give you an idea where we are sitting as a country. As I said, slowly increasing, but certainly not even close to the gray or orange line, according to which we should be sitting at 20,000 cases by now. So as I always said, the truth probably somewhere to be, will remain to be somewhere between the blue and the gray scenario here. Next slide. The Ontario modeling here, that's the one from February 25th. There's a more updated one, but right now it looks like we are relatively closely following this model here. Again, today, 1,500 cases reported. So it looks like the line that I was drawing here continues at a similar slope at this point of time. Next slide. There's a more recent modeling from the science table from March 11th, so from last week. And here it looks like we are doing better than the models would be suggesting, sitting somewhere between the best and let's call it the second best scenario. So again, some good news, despite the fact that the models would have suggested that at this point of time, we would be doing probably already worse than we are actually doing at this point. Next slide. The question remains, is this wave 3? It probably is. Or is it wave 2B? Because we never were as low as we've been over summer between the first and the second wave. I think in the end of the day, it's semantics. We see numbers going up. All the metrics locally, in particular in terms of positivity, hospital admissions, as I said, comes with a question mark there, are showing us, okay, things are getting worse again, which can be or is being defined as wave 3 by most. The big question will remain, will it be a big wave as suggested in the modeling in front of you, or will it be more a wavelet or something similar to wave 1, or better than that? This is still to be determined. And the one piece that will certainly help us with that is the vaccines eventually. The issue is that at this point of time, we still only have a very small proportion of our population vaccinated. It's likely to help us more in a few weeks, couple months from now. So it may help us over the long run to blunt the wave. We expect to see much less impact in long-term care and retirement homes. So we will probably have a different different, I would say, association between number of cases, number of hospital admissions, and number of deaths. The modeling for the city would suggest you would see potentially more number of cases per day than we've seen in wave 2, but less hospital admissions and less death, because the highest risk population at this stage has been vaccinated already. But again, the only piece that really helps us, other than summertime coming, which in itself will help us, is the vaccine. And just whenever you have a chance to get vaccinated, please do so. Next slide. That's the illustration for what I just said. Variants of concern, we are, as a province, sitting at roughly 50% at this point of time, looking at the updated figure from this morning. Hamilton sitting at 35%. So as I said previously, we are sort of dragging behind in that proportion, but catching up eventually, and very likely that in a week or two from now, we will be at that 50% mark, as well as the province on average sits at this point of time. To a large extent, your proportion of VOCs depends on whether you happen to have more VOC or non-VOC outbreaks, and this may skew the data very significantly here. I think that's it from my end. Arno, I have one last slide here. The type of VOC, so for the ones that have been sequenced, you can see it's still first and foremost B117, so your UK variant. Then there's B1351, which is your South African variant, and then P1, the rarest of the three with 34. Within the city of Hamilton, all the variants that have been sequenced to date are all B117s. Okay, handing back to you, Aaron. Thank you.
Thanks very much, Dr. Mertz. Next up on our agenda, we're going to transition to a bit more detail about the vaccine. To give us the first part of that update is Bruce Squires, our Vice President of Women's and Children's Health, and deeply involved in the planning process at the city. So Bruce, over to you.
Thanks very much, Aaron. Good morning, folks. So whenever we've talked about vaccine, I think we've highlighted that there certainly are international and national factors at play, even though vaccines are, of course, delivered locally. Perhaps kind of most important is there's a provincial strategy at play here that really dictates how the rollout happens across the province, and here in Hamilton, what we can do and what we can't. So a couple things on this slide of note. You can see that the province has close to 300,000 folks at the end of the day yesterday, so we'll be over that today, who are fully vaccinated. Doses administered at approaching the 1.5 million, and daily figures you can see 58,000 were the number of doses administered yesterday, and we're nearing what's been described as phase 1 of the strategy. We're nearing the end of that and getting ready to move into phase 2. So let me talk a little bit about what's going to happen next. And again, this is in accordance with the provincial strategy. It's fairly high level still, and so as we get closer, it begins to have additional levels of detail described and then communicated. But really, there's sort of two key pieces to this. The core of the strategy revolves around mass clinic age-based distribution. And so folks will know that we're currently across Ontario providing for vaccination for adults aged 80 years of age and higher. And then phase 2 would see us to begin to move through age bands, probably in 5-year increments, gradually moving downwards. And the majority of those vaccines are expected to be delivered through mass clinics like the one at HHS, as well as the one at the West 5th campus of St. Joe's. And next week, we'll be opening the first Ontario Centre to add another up to 3,000 doses per day. The second piece of the phase 2 strategy gets a little bit more focused on targeted populations. And let me speak to the third bullet here first. So adults with chronic health conditions, obviously of very significant interest to our clinicians. The province envisions that these individuals will likely be vaccinated more through a specialized clinic approach, perhaps using primary care, but perhaps also using settings like our own hospital. How quickly we move through those with chronic health conditions who at the provincial level right now have been segregated into sort of 4 or 5 risk levels, depending on how you look at that. How we sequence and move through those will depend upon vaccine supply. The more supply we have, the more that they sort of all happen at once versus having to be sequential. At this point, again, we don't yet have the details on exactly what that distribution is going to look like, but a working group has been developed with leads from here at HHS as well as from St. Joe's to work with primary care and public health to ensure that that we're ready to deliver that. That's probably going to start in sort of mid-April, although again that depends on vaccine supply. High-risk congregate settings, obviously that's something we've already been doing in starting with retirement homes and long-term care homes and beginning to move into other types of congregate settings focused on seniors. Phase 2 would see the definition of those congregate settings begin to expand. So to include populations that maybe are less senior, that includes adults and youth, other areas, and again, targeted where there's felt to be a significant risk. You'll also see in here, and probably should have separated it with another bullet, that those who cannot work from home or what's often referred to as essential workers. That's a group that would go back to being vaccinated probably mainly through mass clinics or perhaps in some cases at the workplace. Right now, it would appear that that's more likely to be later on in phase 2. And of course, those who get an opportunity by virtue of the age progression may find themselves with the opportunity to receive a vaccine before the province instructs us to turn to those who cannot work from home. Just quickly on supply. So again, we've continued to in the Hamilton area primarily distribute Pfizer, primarily through the HHS clinic, but also have some amount of Moderna. We reported last week on the pilot program underway in various spots across the province using both pharmacy and primary care, targeted at ages 60 to 64. And here in Hamilton, that's involved primary care clinics. And we're at about 55 or 60% of the way through that particular pilot, which has been going well. Can we go to the next slide, please, Les? So again, let's look a little bit more closely at Hamilton. You can see here we're well over 60,000 doses administered, with the HHS clinic continuing to have the largest share of those. When you think about it from a phase 1 population perspective, we have tremendous coverage with respect to our residents of long-term care and retirement homes. Also good coverage of the staff and essential caregivers associated with those populations. When we look at healthcare workers, we have really essentially completed the highest and very high healthcare worker categories and have started on the high category, and in a very short order we'll be turning to those defined as moderate healthcare workers. Again, the province and here in Hamilton has also moved to the age basis, and we are very, very far along in terms of adults 85 plus. And so here in Hamilton, we've now turned as well to the 80 to 84 population, and many, in fact, most of those individuals who are interested have already had the opportunity to book, and there are clinic appointments underway. I already spoke to sort of where the locations are for those vaccinations at a large scale clinic perspective. And of course, we continue to have mobile clinics operating. Really, those are an effort across the city to reach perhaps populations that may be more difficult and more vulnerable. And so again, those numbers are going to go up last week as we see one of our more significant influxes of additional vaccine. Next slide, please, Les. So let's look more closely at HHS and at our healthcare worker population. And so you can see in that first bullet how many of HHS staff and physicians have received vaccines. This second number, the second bullet, that's 96% of our patient-facing staff and physicians who have said they're interested in receiving a vaccine have now received at least a first dose and or have been scheduled for the vaccination. That's 8,900 of the 9,300 who have been registered. Again, we've had the move in relation to the duration or the interval for second dose that Rob has already spoken to, and I believe Fiona will speak to that as well in a moment. Big significant change happening now, and this was first communicated yesterday. We're going to move away from the very resource-intensive approach that has involved staff manning the phones to call out to you as individual healthcare workers to look to book you an appointment. We are now moving to where healthcare workers in this community who have not yet received a vaccination or be scheduled will be able to sign up through the Provincial self-scheduling tool. Now, again, if you have not yet been scheduled for your first dose, or you have not yet received it, of course, then you've been asked to go back into our what we've called our online portal, the St. Joe's Hamilton Health Sciences online tool, to ensure that your healthcare number has been included on that portal registration. That makes us compatible with the provincial booking portal, and that then allows you to be signed up, which I'll speak to in a second, to self-schedule. So let's go to the next slide, please, Les. So as I said, this is really only applicable to those of us who have not yet received a vaccine or haven't been scheduled for an appointment. If you already have one of those, you don't have to do anything. But if you haven't, then you will have received a notice and encouraging you to go in and ensure the online tool includes your healthcare number. When it has that, that list is going to be provided from to the province. Watch your email for a message from the provincial portal where they're going to instruct you on how to self-book an appointment. You'll be encouraged to self-book the appointment at the healthcare worker only HHS clinic. But you will have the opportunity to choose the location for which you'd like to self-schedule that appointment. So watch out to in your email or your text, and that really means that over the next week or so, we can expect that all of our teams who identify that they wish to receive a vaccination will have the opportunity to self-schedule an appointment to receive that vaccine and then to be vaccinated. Just a reminder to anyone who has not signed up to date in any of the categories. Maybe you weren't quite ready, maybe you weren't quite sure. This continues to apply to you as well. So I really want to support and encourage everyone to take advantage of the opportunity to be protected and to protect your patients, your colleagues, and of course yourself and your families by taking advantage. As I close, just want to finally say that and thank the work of colleagues around the executive team, particularly Les Gauthier and Dave McCaig and Michelle Leifler and Dr. Smale, and also Rob for the amount of work that they've been putting into to supporting the vaccination program in the interests of our teams, our patients and families, but also our entire community. And of course, really to acknowledge the work that leaders, particularly Lucas Milinovich, is the director of the program, and Brian Harachuk, who's been handling scheduling, and so many others who have been focusing on the clinic experience, And then all of the teams that have been working so hard to deliver exactly that experience. There's been lots of pivoting and changing on a daily basis, but I think folks have been so positive and so professional in that process. So certainly my thanks for that. With that, I'm going to turn it over to Lesko Che.
Thanks, Bruce. Good afternoon. We're at 12:12. So I have one slide today, which is really the merging of the work from the vaccine group and our PPE task force. And we could have titled it Gentle Reminders, but I actually think the message here is this is probably the most important messaging as we go forward to continue to protect ourselves, our families, our patients, and our colleagues. I learned a new term this week in terms of micro breaches, and we were in conversations as to, some of you might be asking, with people vaccinated, how are we having outbreaks? How is there still a number of new cases that are being identified on a daily basis? And I think it's super important that everybody understands getting the vaccines are awesome, and absolutely we refer to it as light at the end of the tunnel, but it does not replace the very basics of IPAC measures that we have been working so hard as a collective team throughout the pandemic. So that does mean wearing the appropriate PPE, maintaining distancing wherever possible, and the basic IPAC measures. So the PPE task force has done a lot of work. There are some really very informative tools that have been communicated through the hub and are available to people to make sure that when you put the appropriate mask on each day, you're really comfortable that the mask is fitting you properly and you have a good seal. So it is the very basics of, you take your clean mask, you wash your hands, you take your clean mask, you put that mask on, and you make sure that you have a good fit with the PPE that's being provided to you. I just corrected myself on the hand hygiene, because as we've chatted with people, and we do have teams out in the spirit of CQI work, doing some really good process observation work. One of the key findings that are coming back to us is people are very good to wear PPE. Where we're having, quote, micro breaches is just reminding ourselves that we are washing our hands or doing hand hygiene before and after we don and doff that PPE. And remembering just all the significant points of contact around your patient care, and hand hygiene is still identified as the single most important intervention. The third bullet here has actually been identified in one particular case by family who watched people pull their mask down to speak on their cell phone. So pull my mask down, dirty hands, grab my cell phone, talk, put my cell phone back in my pocket, and then pull my mask up. And I think if any one of us reflects, we've probably all been guilty of doing that, whether it's in the grocery store or in the units we work in. And it's really this increased awareness we would like people to have when you're touching equipment, and in particular your personal devices. You need to be thinking about, am I contaminating the device? Am I contaminating myself? The last bullet, I think the Canada Health has actually got some very, very good commercials that people may be seeing on TV, showing that there is a very nice and non-confrontational way that if you see your friend, your family, or your colleague breach any PPE or IPAC practices, it is our individual's accountability and responsibility to nicely correct them. So the commercial, the young girl kind of clears her throat to point to the guy standing beside that his mask is under his nose. We owe it to each other. The vaccine is not going to eliminate totally the risk of getting COVID, but we need to find a way, either individually or as teams, that we can hold each other accountable to what's been labeled as the micro breach. And as I close, I know everyone who is listening today is very concerned and committed to keeping ourselves, our families, our patients, and our colleagues safe. I encourage people to go back and say, how do we use the standard tools to audit ourselves? How do we gently correct each other, and maybe not so gently if it bluntly needs to be corrected? But vaccines alone are not going to be enough. So no gentle reminder, strong message that we need to remember PPE, distancing, and our PHAC measures. Thank you. So I'm going to hand it back over to Aaron.
Thanks. I think we have Dr. Smale as well to give us a little bit of an update around the issue of vaccine safety. Fiona Smale is a medical microbiologist and infectious diseases specialist who's been joining us on these town halls to share her expertise in this area. Dr. Smale, over to you.
Thank you very much, and I'll be brief as I know we're running out of time. I've been asked to just talk a little bit about vaccine safety and hesitancy, and staff who have been hesitant about getting vaccinated still may be uncertain about the benefits and safety of the vaccine and have questions. And this is quite normal. In fact, if we didn't have questions, that would be what would be abnormal. In the last 3 to 4 months, actually 400 million doses of vaccine have been given worldwide. And I think in December, when we started with the vaccination program, there was still a lot of questions we didn't have answers to. But over time, with the amazing rollout of vaccine, the overall safety of the vaccines has been confirmed. And as well, there's convincing evidence that all of the vaccines, and that includes the Pfizer-BioNTech, the Moderna, and the AstraZeneca, are preventing hospitalizations and death from COVID. This was always the first goal, and I think as time goes on and we get higher rates of vaccination, we can be more confident about the effect of our vaccines on transmission and the risk of exposures. So I know that there have been some recent concerns about the AstraZeneca vaccine, but when you put this into perspective, the very quick inquiry into is there a risk or not really has confirmed that there is no evidence of a complication associated with the AstraZeneca or really any vaccine. And so I think we can now move forward with confidence with any of the vaccines that are being offered. And just really, if you do have questions, if your teams have questions, reach out to us, reach out to the trusted friends and colleagues with your concerns. It's good to talk about it. And as Dr. Mertz has commented, if we can just get our vaccination rates up a little bit higher, and we should be able to get those curves down. So I would just encourage you to have a discussion, and any of us would be happy to clarify any questions you may have about the vaccine.
Wonderful. Thanks very much, Dr. Smale. Okay, conscious of time, we have a number of questions. I'm going to suggest we had last time, Bruce, a bit of a lightning round with you. I know you've been following the Q&A as it's been coming in. There's a number about process here, registration, things you touched on. Can you maybe do your best to try and bang out a few of the answers to the questions in the chat in the box now?
Yeah, thanks very much, Aaron. I'll do that as quickly as I can. So questions around the second dose. I've had a first dose. Do I need to re-register at all? No, you do not. So you do not need to do anything except watch for the notification of your second dose appointment, which will come by email or by text. Question about someone who say was 85 or 86. And didn't actually get the vaccine, and we've now moved to 80 to 84. Have I missed my turn? You can't miss your turn in the province. We'll continue to have eligibility for prioritized groups, even if you move on kind of in the strategy to the next group. Question about whether out of region vaccinations are permitted under the provincial system, and the truth is that yes, it does, and the system does prevent that. Does allow that. So you can have an individual, particularly if they work in a different region, who will decide to self-schedule for an appointment in a clinic outside of where they live. The question around timing, particularly as it relates to the remainder of the healthcare worker group, including those folks in the moderate category within the hospital, or previously the sequence 4. Again, we understand that that will be soon, so please watch for the notification of the opportunity to self-schedule. We do not believe it will be long to come. Question around how do folks sign up who are in something other than the age-based categories like chronic health conditions or those targeted community organizations. So work is still happening at the provincial and the local level to do direct reach outs to those groups to get names and information to allow for either the self-scheduling of those individuals or for the booking of mobile clinics. So still to come on exactly how that'll happen. Some of that may happen through primary care offices, but also through our own patient lists. So so more to come. I think that covers them all.
Yeah, excellent job, Bruce. Maybe just one clarification around those with chronic conditions or illnesses, so patients or future patients. You know, you mentioned earlier there's 4 categories or risks levels being assigned. I assume, is it fair to say then that that's the process that'll kind of people can look to in the future to know where they would fit in that group? Like if somebody is right now has a cancer diagnosis, as an example, they would be put into one of those risk levels, I presume?
Yeah, that's the initial thinking, Aaron, that that the province would progress through those highest risk, then high risk, then moderate. But honestly, it depends on vaccine supply. If we get the level of vaccine influx that we'd really hope for, then you may find we can blend those together. And in fact, there's not kind of the delay from one risk level to another. So again, lots more to come on that soon, but we can know we've got a team of our own experts who have put their hands up to work on developing that process for here in Hamilton.
And I know there's been lots of news about very optimistic about supply. The commitments are very like it's good to see. Is there optimistic discussions then also about narrowing that 16-week window between first and second dose as supply permits? And how does that fit, I guess, with this, what we just talked about with the opportunity to roll it out to more people?
Yeah, thanks very much for that question, Aaron. As Rob said right off the bat, the core of this strategy at the provincial level is endeavoring to get as much of the population with the significant immunity associated with the first dose. And so, no, the conversation at this point hasn't turned to changing that decision around dosing interval. All of the concentration has been on getting as many people with vaccination as possible.
I see. And just in relation to something you said, maybe Dr. Smale, I can pick your brain a bit. Bruce had mentioned the notion of the significant immunity potential that's garnered from a first shot. I mean, one can read conflicting reports in media about the percentage of immunity, if you will, that's provided by a first shot. What should we be looking for? What should we believe when we read things in this regard?
It is difficult because the information on which it's based is changing really day by day, and a lot of it is coming from observational studies. I'm estimating around 70 to 80%, but again, it depends on what you're looking at as the outcome. If you're talking hospitalizations and death, then it's approaching 95 to 100%. So be confident in that first dose in terms of the serious outcomes of COVID infection, but recognize that we still have to maintain our precautions until we can move to the next stage.
Wonderful. 95 to 100 is pretty darn good. There's been also a lot of media scuttlebutt about the issue of the safety of the AstraZeneca vaccine. I'm sure some of it might be fair, some of it might not be. What can you say about that particular issue?
Well, if anybody is sort of watching their phones and the news releases that are coming through at the moment, you will just see that the AstraZeneca vaccine has been given I'm going to say, a vote of safety approval from international organizations. The Europeans have done this. So I think there was a flutter of activity, which is appropriate because we have to monitor these things very closely. It's been evaluated very thoroughly, and we can move forward with confidence with the AstraZeneca for really any populations. I know there have been some discussions about the older age group and the AstraZeneca vaccine, and we'll just have to see how our supplies roll out. But it is a safe vaccine, and any of these side effects that have been concerning really have been put to rest.
Okay, wonderful. I'm conscious of time. I know we've moved through a lot of content around the vaccine. I know there's other questions, still a number of questions in our Q&A. I want to be respectful of people's time, but also the information that you need through the Q&A. So we'll do our very best to reply to those, some directly where it's possible to do so, some on the hub. And if you have not had the opportunity yet, please know there is an extensive and growing Q&A document around the issues that we're discussing here, specifically related to the vaccine and the vaccine process. So you have access to that. We'll also use those questions to form the basis of our next weekly update, our town hall next week, which we will undoubtedly cover some of the same ground that we've covered today, and hopefully some new areas. Perhaps we have a couple of minutes for celebrations. If you wish to use the chat forum to type a celebration, then Rob or I would be happy to read that. If you'd like to raise your hand in the participants forum, we can call on you to issue your celebration live. As Rob pointed out at the beginning, we are continuing through the month of March to acknowledge and recognize and reflect on the commemoration of 1 year of a global pandemic that still endures. I'm sure there's lots we can celebrate and lots we can remark on, so now's the time to do so.
Yeah, Aaron, I would actually like to shout out to Bruce Squires, because he was very generous about giving credit to what has been an amazing team of people working on getting the vaccines out. But Bruce himself has been an extraordinary leader for all of that. So thank you, Bruce, for all the work you put in. I know it's been immense to get us to where we are today.
Absolutely. Kelly, I see you've come on camera. Would you like to issue a celebration of some sort?
Yeah, absolutely. It's along the lines of retirements, which seems to be a big theme these days. David Lacourt, our Director of Procurement and Supply Chain, is retiring at the end of March. So we'll certainly miss David. His contributions to HHS over the last 5+ years have been significant as we think about some of the major initiatives that we have underway that David was really key in helping to negotiate. Then at the same time, I'll welcome Robin Simmons, who is our new Director of Procurement and Supply Chain. Robin's first day was yesterday, so some of you will have the opportunity to meet her and be in Zoom meetings with her over the coming weeks. So we'll welcome Robin to the organization.
Good stuff. Thank you for that. Rob, I see here a congratulations from Linda Campbell to Fiona Dawson, Executive Assistant, on her retirement as well at the end of March after 30 years at HHS. Congratulations, Fiona, and thanks for all you've done for HHS. Well, I'm going to suggest we close out. I know we've probably got lots more we could celebrate, but time is a premium today. So Rob, over to you for closing remarks.
Yeah, thanks, Aaron, and thanks everybody for coming today. Lots of engagement around vaccines. I know vaccines is a very personal thing, and so I understand both people's anxiety, but also their engagement in this. And I do think, well, we're not in a perfect place. We're in a much better place than we were not that long ago. So We'll continue to make our way through as much of the HHS staff as we possibly can in accordance with vaccine supplies and in accordance with the framework set out by the province for prioritization. But I think we can all feel some optimism that good progress is being made and will continue to be made in the coming weeks. So thanks all, and I hope you have a great rest of the day and a great rest of the week. And hopefully we'll see you all again next week. Cheers.